Hi there, Kevin Infante here. Thank you for joining me this afternoon. I want to talk to you about a particular type of medication used to treat pulmonary hypertension. This drug is called epoprostenol, known by the brand name Velitri or Flolan. Epoprostenol is under the category of vasodilator and is also a platelet aggregation inhibitor. Let's go over the quick pathophysiology of pulmonary hypertension. Pulmonary hypertension is high blood pressure in the arteries and lungs and the right side of the heart. A particular form of this is pulmonary arterial hypertension, wherein the vessels in the lungs are narrowed, blocked, or damaged. This makes the heart pump harder, and as time goes by, the heart muscles weaken and fail. There is no cure for pulmonary hypertension, although there are treatment options with the goal of symptom reduction and improving quality of life. Velitri and Flolan are two of the major drugs under the prostacyclin category. These medications are given through a continuous infusion pump. Both of these medicines have a half-life of about 2 to 6 minutes. Now let's go over the mechanism of action of epoprostenol. The two main actions of epoprostenol include vasodilation of pulmonary and systemic arteriovascular beds. Also, there is a platelet aggregation component. Platelet aggregation is done by stimulation of an enzyme that leads to subsequent increase in cyclic AMP in the platelets. The increase in cyclic AMP results in vascular smooth muscle vasodilation. Hemodynamic effects of these medications include decreased pulmonary vascular resistance, increased cardiac index, increased oxygen delivery, and hypotension. There are many drug interactions that could occur from these drug category. Use cautiously with other antihypertensive medications, as this can drop your blood pressure some more, and also with concurrent use with anticoagulants and other platelet inhibitors because of the increased risk of bleeding. Let's talk about efficacy and safety of the medication. Studies have shown that there is increased long-term survival over 3 years in pulmonary hypertension patients when they use prostacyclins. The FDA first approved these medications back in December of 1995. Safety factors that need to be taken into consideration include monitoring your blood pressure for hypotension and proper management of the infusion pump Abrupt disruption of the infusion can cause rebound pulmonary hypertension and could be fatal. Also, we need to prevent infection at the central venous catheter site. Let's go over the cost, outcome, and follow-up care for these patients. The cost of Velitri is about $34 per unit for an IV form, and the generic epoprostenol is about $23 per unit. Outcomes have shown statistical improvement in exercise capacity based on a 6-minute walk test and decreased dyspnea and fatigue, leading to better quality of life. Follow-up care for these patients include frequent management and follow-up with the providers. Chronic prostacyclin infusion, the patients need to come in every 1 or 2 months or as needed to the pulmonary hypertension clinic. Sildenafil, phosphodiesterase inhibitor. Sildenafil is a phosphodiesterase inhibitor, which is another drug class used to treat pulmonary hypertension. The mechanism of action of sildenafil, commonly known as Viagra, is through the inhibition of phosphodiesterase that leads to peripheral pulmonary vascular relaxation and subsequent pulmonary vasodilation. There are many various interactions with sildenafil, many of which include notable blood pressure medications, blood thinners, antifungals, antivirals, and St. John's wort. Monitoring and safety for this medication includes monitoring your blood pressure and the interactions that are associated with the drug. The cost for sildenafil is significantly lower compared to Velitri and Flolan, which is about a third of the price. I hope you learned something from this short video presentation about epoprostenol. Thank you.